Hello guys, what's happening? Hopefully you're all doing great. I'm walking in the streets of Arusha here in Tanzania. It's beautiful morning here, I think maybe 25 degrees. In this video you will learn more about vaccines, what you need when you are coming to Tanzania, the regular vaccines and also COVID vaccines, and also a little bit more about the health requirements, some information and tips that you may need to know before you are coming to Tanzania. So let's talk about vaccines in Tanzania, including also COVID vaccines. So make sure that before traveling to Tanzania, all of the general vaccines are up to date. It includes tetanus, polio, MMR as well, means mumps, measles and rubella. And also influenza vaccine is something that they recommend. So the COVID requirements at the moment in Tanzania. So for vaccinated people traveling from the US or from the Europe, there is no need for provement about the negative COVID certification. But if you are unvaccinated, so you have to bring your negative COVID certificate. And from the US people, it have to be less than 98 hours old, and from the Europe it have to be less than 72 hours old. But I recommend to check anyways the necessary travel requirements and the documents at the moment. So I will drop the link down in the comments for the traveldoc.aero. So from there you can see the travel requirements at the moment. So they are updating it almost every day. When arriving to Tanzania, they are not asking any another vaccine certificate. But if you are traveling from or through the countries, including transit longer than 12 hours, with risk of yellow fever, so then you have to have your yellow fever certificate with you. Yellow fever vaccine is valid for lifetime. About the vaccines as well, hepatitis A and B are highly recommended in Tanzania. Rabies is also common in Tanzania, as here in Tanzania is a lot of street dogs, wild animals. If you are traveling somewhere in the bush, so you can get scratched or bitten accidentally by wild animal or maybe street dog. In Tanzania, here is also hospitals where you can get rabies vaccine afterhand if you get bitten by dog. Let's talk about malaria. So malaria is common disease what mosquitoes are carrying. If you are traveling to Tanzania for short-term visit, for safari or just a holiday, so I recommend take malaria medication. Here are a few different kind of malaria medications available. So I recommend you to talk with your doctor and find the best one for you. Most of the malaria, you can cover yourself against the mosquitoes as well with the clothes. So make sure that you pack with you a long sleeve shirt and as well pants that will cover your legs. And also they said that white is good color, so you can also see the mosquitoes when they are there, but I can tell you that you can also hear them. The sound is really loud. And when you are going to the hotel, put your mosquito net over your bed, so before you are going to sleep. Anyways, in case that you get fever, muscle and joint pains, or you feel dizziness. So you have to always remember that you can still have malaria even though you have the medication. So you can check malaria almost in any hospital here in Tanzania. They can also treat it here in good way because it's a common disease in tropical countries, so you will get treated. And also, after traveling back to your home country, make sure you eat the malaria medication the necessary time also after your trip, because most of the medications, you need to eat them a couple of weeks, maybe 2 weeks after the trip as well. Before traveling to Tanzania, make sure that you have good health insurance, and also make sure that it will cover treatment against malaria. In some of the travel insurances, they can say with small print there that they are not covering the tropical diseases. So if you have to go to the hospital and you maybe have malaria, so they can say that they are not going to pay the treatment. Make sure that your health insurance is also going to cover emergency air evacuation. So in case the serious health problems, so they might evacuate you to another city or maybe back to your home country. So make sure that your health insurance is going to cover it, because otherwise it's going to be really, really expensive. So in case you need a hospital treatment, I recommend to go to the private hospital. Private hospitals here in Tanzania are much more better condition than the public healthcare and the public hospitals here, because they are getting donations. And also in private hospitals, the doctors are speaking more English. Still, you have to remember that you are in one of the poorest countries in the world, so you can't expect the same kind of treatment and technology that you maybe have in your home country, in Europe or in US. But in my experience, I don't have anything bad to say about the healthcare here in Tanzania. A few years ago, I was traveling while I was having the blood clot here in my head. So I had to use the medication for that, and I had to check the iron level from my blood. So I found one really good laboratory called Lancet Laboratory here in Arusha, where they are checking almost anything that you have to check from your blood or your urine. So I recommend that laboratory if you have to check some specific thing from your blood. Almost any hospital you can check the general things from your blood, but if you have to check something specific, so Lancet Laboratory is one that I recommend. But that is my experience, and here in Tanzania, unfortunately, it means that if you need good healthcare, you also have to have cash. And also, when you are going to see the doctor, you have to pay in cash most of the hospitals. Here are also few hospitals that you can pay with a card, but make sure also that you always have cash when you are going somewhere, even not hospital, but anywhere here. And also you have to pay beforehand. Before you are going to see the doctor, you have to keep the cash. So it's not possible to get bill or something you will pay later. So for locals, you either have to have health insurance or you have to have cash that you can see the doctor. So if you don't have international health insurance, make sure that you bring cash when you are going to the hospital, because if you have your own country, the local health insurance, it may not be accepted in the hospitals in Tanzania. So you have to pay first and then it later back from your own health insurance company. If you have any regular medications, I recommend you to take enough amount of medications with you. Here are good pharmacies in Arusha, in Dar es Salaam, in big cities, but here can still be only limited amount of medications available at the moment. For example, I am struggling with the migraine, so sometimes here is anti-migraine and sometimes it just finished. So I always have to bring a lot of anti-migraines with me when I'm traveling for longer period. So hopefully you get some good information and some tips, and don't forget to check the traveldoc.ir before you are traveling in case the requirements has been changing. And don't forget to press subscribe.